I'm Dr. Anthony Kaveh, and around this time of year, I have many patients that come in, especially service members, because of post-traumatic stress disorder that flares up around the time of fireworks. There's no question that this can bear a lot of resemblance with addiction, even though my patients don't like to hear this because of a tremendous stigma around the concept of addiction, which is a disservice to them and makes it so much harder for me to help my patients who are suffering, whether it's fentanyl or it's fireworks. The underlying survival mode and a subconscious dependency on it makes treating this so challenging if we're not all on the same page. And you're going to learn specifically how to identify some of the subconscious dependencies and how some of my patients, I should say many of them, can work to overcome it. Specifically, you need to recognize that patients that revolt at the thought of even having a label of addiction is just a reflection of society's stigma, is not a reflection of the reality of what they are trying to overcome. If we can move past this and recognize that dependency without awareness is driven by a subconscious, really a self-protective process or a need to protect our body, it helps us recognize that the brain craves control. If you're going to take one thing away from any of this today to help yourself or others who you care about, please remember that your brain is always striving to maintain control of the body itself and its surroundings, and will use survival mode in a way to get it. Have you ever felt like you were in survival mode? Do you know what survival mode actually means? I'm going to check out the comments here and see who here resonates with this. I already see people. Yep. Candy, Paul, Deanna. Yeah, Wendy, I'm so happy to hear that you guys appreciate this. And I want to see who here knows what survival mode actually refers to. So if people are feeling it every day, I wish I could pronounce that username there. Survival mode, what you need to know is that it is when we do not have control and we have threats. When we have been traumatized in the past, we lose our ability to discriminate between real and perceived threats. And this is why I see so many people in here talking about being in survival mode. I can't even go through Miss Tree Moon, Lola, Lexi, Mitchell, Wendy. You're all dead on about what happens to the brain as it tries to regain control. I'm going to give you 3 commonplace examples, and then we're going to go into PTSD specifically. These are such layman's examples, but you'll appreciate that they all surround a concept of control. Caffeine is number 1. When we are not on alert mode, when we are fatigued, don't have energy, can't focus, what does caffeine do? Well, as a neurochemical, it gives us more vigilance. It increases our focus, lowers our response time, helps us regain control of a situation when we're not in control. Example 2, compulsive exercise. Have you ever heard of someone who, I know some people are like, what is this compulsive exercise? But some people really have this compulsion to exercise every day strenuously without the cardiovascular benefits that most of us are seeking. The loss of control here is when individuals have an overwhelming stress and their subconscious recognizes that the endorphins or enkephalins that are released in response to aerobic exercise, sometimes anaerobic exercise, even walking, which is good news for the rest of us, decreases our fear response. This has been well documented. I don't even need to go into individuals with an image dysmorphia or a body dysmorphia. When there's not control, the body tries to do things to give us a better sense of control, even if it is simply reducing fear, which robs us of awareness in the moment. And I'm looking at the comments again. I know that many individuals here are talking about being easily startled. Anaerobics queen here. You know exactly what I'm talking about. Now, there's many other examples. Eating. What is a loss of control? When it happens when we feel this varies tremendously. This is not applied to every patient, but emotional distress, tremendous anxiety, not being in control of our emotions is incredibly unsettling because we cannot focus, and your brain knows that it cannot attend to one task. It runs the risk of losing control. There is no question that sugar, fat, and salt are powerful ways to relieve certain anxieties and help us perceive a greater sense of being present in the moment. Now, fireworks. This is what this is all building up to. And please recognize that this is the quintessential power play that your brain tries to pull on your body when it has lost the ability to discriminate between real and perceived threats. Recognizing that this is not the case in every patient with PTSD, nor every combat vet with combat-related PTSD, but it is a canonical example of when the fireworks go off, the sounds, the sights, trigger within somebody that panic attack-like response, elevated heart rate, high blood pressure. Guys, I've even induced a panic attack-like body state in myself. I have a video of it. I'll link it below. Where on the life support monitors, like the one you see behind me, you've actually seen my heart rate and blood pressure all spike up as I hyperventilate. That response in your body is giving your body control to an extent. It's raising your blood glucose so that your muscles can fight or flee. Raising your blood pressure so you can respond, bam, in the moment. That is a sense of a microcosm of control. And here is the problem. The hyperarousal, which is the fix to not having control in the face of threats, ultimately is a form of addiction in many, if not all, patients. Because the root word of addiction is none of my patients have ever actually known this. The root of the word addiction comes from Latin, meaning to be enslaved. I'm going to look at the comments. Did anyone know that? Did anyone here know? Robin's talking about feeling tired with caffeine. There's many polymorphisms, by the way, in our receptors for caffeine. So you might be one of the few ones. But the point is that when we do not have control, our body will respond in a way to give us even a semblance of control, even if it is at the expense of long-term harm, which brings us to the definition of addiction. And once again, none of my patients have known this, so please know this, learn this, and share it with your loved ones to help empower them. An addiction is anything that gives us short-term benefit at the expense of long-term harm without the ability to hit the abort button. Therefore, when someone is jumping up and being in a hyper-aroused state, that is their subconscious trying to protect their body. Short-term benefit, long-term harm is clear. Cardiovascular health, cognitive health, cerebrovascular health, tangible detriments on the long-term health, no question. But you can't hit the abort button. So therefore, I ask you, and I'm going to give you guys a shout out, who here can appreciate that that combat vet is stuck in this example case? It's not every vet, and I do see people in the comments here sharing that it's not the exact symptoms that they have, and that's okay. There likely is another subset of symptoms in many patients, not all, where there's a short-term burst of reaction which puts us in a long-term bad place, but we cannot get out of it. We're stuck. And we don't want to be stuck in that PTSD loop any more than the alcoholic wants to be stuck addicted to alcohol. Then the fentanyl addict out there in the Tenderloin wants to be stuck in that loop of fentanyl. Because here I see that Mariel's already mentioning there are other triggers. Absolutely. And other people drink alcohol. I understand that in the comments. The resemblance here is so important to recognize, because if we accept that our trigger and behavior, or our stimulus and response timescale collapses when we are in survival mode, it gives us an intervention point. You all know that I use the stellate ganglion block. I use ketamine IV infusion therapy to help prolong the space between stimulus and response. If we can prolong the space between stimulus and response, when someone is stuck in a loop, agnostic to alcohol, opioids, vending machines, slot machines, doesn't matter. We provide a powerful venue into being able to address that enslavement. So we're not just stuck in this loop where we cannot abort it, but hopefully we have more space between that stimulus and response. The altered states of consciousness afforded by ketamine, by deep meditation, by some patients in this room with general anesthesia even. The classic example being smoking cessation. Even in operating rooms like this, the altered state of consciousness can break these hard-coded loops that so many of my patients are stuck in. That smoking cessation is one of the most powerful examples because nicotine is one of the most addictive substances known to mankind. And yet there are just example after example of patients quitting cold turkey after surgery. Hey, Lanakia, I'm so happy that you quit smoking. That's incredible. And wonderful, wonderful comments here. I appreciate Eric L, the kind words. T-Care, I'm so happy this came in at the right time. Heidi, thank you for reminding everyone that if they're learning something new, please hit that like button and share with others. And before we launch into the Q&A, it's not just altered states of consciousness that can do this. Absolutely not. The stellate ganglion block is an example of being able to break the fight-flight response. You can check out my videos where one of my patients let me film me doing the block on them. That's not an altered state of consciousness. So there are many ways of doing this, and not all altered states of consciousness need external drugs to prolong the space between stimulus and response. But I encourage that you learn what options are out there so that you can better advocate for your health, because let's face it, our healthcare system does not tell patients this, and you deserve to know what the options are. I want to jump into the Q&A because you have asked so many wonderful questions. And Clam Geek, what can we do if we feel we don't produce enough dopamine or serotonin? Well, you need to speak with your doctor. I can't specifically comment in your case. There are some imbalances of certain neurochemicals. They tend to be depleted when we are in a chronic state of survival mode. So you're stuck with a chicken and egg problem, but that's why you need to speak with your doctor about how to break it. I've shared some of my techniques. You can watch my videos specifically on that. Jill notes that I've recently figured out eating a lot of beef helps me in this. That's wonderful. It's not a typical thing we recommend, but we had to recognize, similar to the last question, that certain foods can maintain an imbalance of neurochemistry. No question. Overly sugary processed foods are key culprits. Now, Lisa's been mentioning a lot of different mind-altering substances, ayahuasca, ibogaine, psilocybin. There are many ways, but remember, you have more control over your health. I want you to have an internal locus of control. Well, I hope that that's what you would want, to release our external needs, our dependency on an external substance. So I appreciate that there are many, I see, Lisa's really bombing us with a lot of examples, but you don't need to have an external substance. Gabby is saying, I can say something as simple as a sight, sound, smell can be a trigger. Absolutely, because a trigger is simply something that sabotages your central nervous system. Nothing more, nothing less. And if we can help prolong the space between that trigger and how your body responds, that is, in many cases, the first step to finding a lifelong sustained healing. James has had PTSD twice, resolved it with meditation and counseling. Perfect example of not needing an external substance. Of course, it's going to be dependent on the patient. Neuropilot, very, very good. Breathing can be a trigger. Yes, bushy-haired stranger. You know that there's a particular breathing technique that will increase your norepinephrine levels. It is similar to what Wim Hof does. Have you guys heard of Wim Hof and Wim Hof breathing? It can be a trigger for a release of endogenous catecholamines. They stuck him, I believe, in Michigan in a PET scanner to see how he's able to maintain his body heat. It appears to be in response, at least in part, as a result of how he breathes. So you're right, it can be triggering. Hey, Eric L. So thank you for the kind comments. And remember, if you're learning something new, hit that like button and share with others. Medication nor therapy have helped me. Gabby, I'm curious what medications and what therapies you've tried. There is no one size fits all. It's why I had to leave the medical system to do the work that I do, because unfortunately, the US healthcare system does not acknowledge the individualized care needed, because everyone has a different narrative. And not every SSRI works for every patient. Not every TCA works for every patient. Ketamine does not work for every patient. You need to have a doctor who knows the different options. Remember, you don't want to go to a hammer nail scenario where the specialist is a hammer and views everyone as a nail. Have you ever felt that way before? Have you ever felt like you've just been another nail and the doctor recommends the same thing for everyone? Heidi, thank you for that kind comments. Ringo's talking about cold plunge. That works for many individuals. Isn't the fight, flight, freeze uncontrolled? No, not always. The fight, flight, freeze response can be controlled in certain cases. When we have been traumatized in the past, we lose our ability to regulate it because we lose the ability to discriminate between real and perceived threats. And Arakel, we need to learn more about George Carlin. Hey, Matisha, so good to see you. Buffy, I'm sorry that you feel like a nail. I hope that you can find a provider, a healer who does not treat you like one. Hey, if you guys are learning something new, it's a reminder to hit the like button and share with your loved ones. Just me, we all underestimate the power of our own minds. Yeah, I believe that most of us do, which is why I always emphasize that you have more power over your health than you've probably ever been told. Animals like horses and dogs can heal PTSD. Yeah, so can animals like humans. It's what I do with my patients every week in my clinic. Yes. I use breathing exercises versus stimulants. Yes, T-Care recognizes that our breathing, this is something that people don't talk about. When you're anxious, your breathing tends to respond to your anxiety. But your breathing can also trigger anxiety. It's a two-way loop, which is why breathing is one of the shortcuts between our mind and body to affect our heart rate variability, our blood pressure. Lola gets it. Thank you so much for the super thanks. I get fight flight when my man raises his voice because of past abuse. Could ketamine help? Lola, I can't give official medical advice. I'd recommend that you speak with your doctor. I will say I have had many similar examples where once we have addressed any domestic violence that has to be addressed first, if that is no longer occurring, then we can talk about ways to disentangle or decouple the triggers from how our body responds. That is the goal of any type of long-lasting work. I have done it with ketamine, but you need to speak with your doctor. I'm really wishing you the best, and I hope everyone else here does as well. Great question about where can we find these breathing exercises? Sky Blue, I have a couple of my other videos where I've done certain breathing connected to the life support monitors, and you see the changes in my heart rate variability. I actually have many examples of it. I recommend that you that you check them out because you can actually see my physiology live. Samuel, all music with headphones on. All with the music. Can you listen to your own music with your headphones on? Not following, sorry. Not following. And Lexi commiserates with Lola. You're not the only ones. I've had many patients in that situation. I'm so sorry about what you have been going through. I would not want you to think that there is no hope. There likely are ways. It might be different for every individual, but to normalize that response is not appropriate. Because if we leave PTSD unaddressed, we run the risks of undertreated mental health conditions, as well as the risks from the medications used to treat that. So I'm going to answer one last question. And, actually, does ketamine help with OCD, the emo surf? There is not as strong evidence. In my clinic, I have used it. It has been beneficial for some, but not all. Depends on the individual, depends on the doctors. Very good questions. Yoga is a good exercise, yes. And I will end with Mariel Davison. It seems like an autonomic response. Angry tone and I am triggered. Yes, because a trigger by definition is something that is sabotaging your central nervous system. That includes your brain, brainstem, and spinal cord. And that's why you have the blood pressure rises. You have the sweaty palms, dilated pupils, etc. Many individuals can decouple. If we recognize that it is a loop, it is very similar to dependency or addiction. A subconscious one, not one that we're actively wanting to do, but remember again that the alcoholic does not want to be stuck addicted to alcohol. Neither does the opioid addict, neither does the gambler addict or the sex addict. This is about recognizing that the combat vet does not want to be stuck in that loop. But we can use a similar framework in some cases with the right interventions like the stellate ganglion block or IV ketamine to be able to break that loop through the neuroplasticity afforded by these. But there are many other therapies. I'm going to share the ones that I do, of course, but there's so many other, and you need to find a healer that can give you a response, give you a suggestion right for you. It's not one size fits all. Please don't forget that. And please remember that you have more power over your health than you've ever been told. Until next time.